Easy Humanly English. You place immense trust in your medications, a trust that has been built over years, perhaps even decades. Some of these pills and capsules are a daily ritual, as ingrained in your routine as your morning coffee, while others are reserved for specific moments of need, a comforting presence in your medicine cabinet. It's rare to question their presence, their purpose, or their long-term implications. Perhaps your doctor initially prescribed them, or maybe you acquired them over the counter at the pharmacy, no prescription necessary, and over time, you've come to rely on these small containers as if they were an inherent part of your very being. Yet today, I am compelled to share a crucial truth, one that requires a calm and respectful delivery, but which is undeniably vital for your well-being. There exist 5 categories of extremely common medications frequently found in the homes and cabinets of individuals over the age of 60, particularly here in Brazil, which, under certain circumstances, and especially with prolonged use, can significantly elevate the risk of experiencing a heart attack or a stroke. The profound aim of this discussion is not to instill fear or to prompt you to discontinue any existing treatment on your own initiative. Quite the contrary, its purpose is precisely the opposite. It is to empower you with essential knowledge, fostering a much more intelligent, informed, and ultimately safer conversation with your healthcare provider. From the outset, I must implore you to take one crucial instruction to heart, and please, consider this with the utmost seriousness it deserves. Absolutely no information presented here should ever be interpreted as a justification for you to independently cease taking any medication. In fact, some of these drugs, an abrupt cessation can be far more perilous than continuing their prescribed use. Certain medications necessitate a careful and medically supervised weaning process, often involving a gradual reduction in dosage over time. Others, if discontinued at an inopportune moment, possess the potential to trigger severe health crises that could require immediate medical intervention. Therefore, I ask you to make a solemn promise to yourself right now. You will absorb all the information, carefully note down what resonates most with your personal circumstances, and then, without delay, bring these insights to your very next consultation with your doctor. Is that a clear understanding? I am Dr. Sofia Ferreira, a physician trained at the prestigious University of Lisbon with a specialized background in cardiology. Over more than 15 years devoted to caring for individuals aged 60 and above, I have gained invaluable first-hand experience witnessing the intricate ways in which the mature human body interacts with medications. I've observed countless instances where a drug, once deemed perfectly safe and effective for someone in their 40s, begins to behave entirely differently when that same individual reaches 65. This phenomenon occurs because the human body undergoes profound transformations as it ages. Metabolism shifts, organs like the liver and kidneys become less efficient, and what was once a light burden on these vital systems can, over time, become a significant stressor. It is precisely these critical changes and their implications that I intend to illuminate for you today. We will delve into these 5 specific medications, starting with the most commonly encountered and progressing to the one that might be the most surprising, and indeed, the one that causes me the most silent concern. The 5th and final medication on our list is quite likely present in your own home at this very moment, a drug you may have been taking for years without ever truly questioning its necessity. Please stay with me until the very end, as this information could be profoundly impactful. Medication number 5. Common anti-inflammatory drugs, non-steroidal anti-inflammatory drugs, or NSAIDs. These are the familiar medications like ibuprofen, diclofenac, naproxen, nimesulide, and a host of others that are readily available in almost any pharmacy, often without the need for a prescription. They are the go-to solutions for a myriad of aches and pains, headaches, joint discomfort, back pain, muscle soreness, and general inflammation. And it's true, they do work. They are undeniably effective in alleviating pain. However, the fundamental concern lies in what else they do beyond simply quelling discomfort, especially in an aging body. NSAIDs exert their pain-relieving and anti-inflammatory effects by reducing the production of substances known as prostaglandins. While this action helps with pain, these very same prostaglandins play crucial roles in several other vital bodily functions. They are instrumental in protecting the delicate inner lining of your blood vessels, maintaining their integrity and flexibility. They are key regulators of blood pressure, helping to keep it within healthy parameters. Furthermore, prostaglandins are essential for maintaining optimal kidney function, ensuring these vital organs efficiently filter waste from your blood. When you take NSAIDs frequently, particularly for several consecutive days or in high doses, these collateral effects begin to accumulate. Your blood pressure can start to rise, placing your minutes to increased strain on your cardiovascular system. Your kidneys become overworked, struggling to maintain their filtering capacity, which can lead to fluid retention and further exacerbate high blood pressure. Additionally, these medications can make your blood more prone to forming clots. In individuals who already possess pre-existing risk factors for cardiovascular disease, such as a history of high blood pressure, diabetes, high cholesterol, or previous heart problems, this combination of effects significantly escalates the risk of suffering a heart attack or a stroke. Numerous studies published in reputable medical journals have clearly and consistently documented these concerning associations, providing robust evidence of the dangers of indiscriminate or prolonged NSAID use in vulnerable populations. What to discuss with your doctor? It is imperative to engage in an open and honest dialogue with your physician regarding your chronic pain. Question whether your persistent discomfort genuinely necessitates the ongoing use of anti-inflammatory medications, or if there might be equally effective yet safer alternatives. For many types of pain, especially mild to moderate pain, acetaminophen, paracetamol, often presents a safer option for your heart and kidneys. For localized joint pain, topical anti-inflammatory creams or gels can be highly effective. Because they are applied directly to the skin, they are absorbed into the rest of the body in much smaller quantities, drastically reducing systemic side effects. Furthermore, don't overlook non-pharmacological approaches. Physical therapy can be transformative in improving mobility and reducing pain. Applying heat or cold packs can offer significant relief. Regular stretching can enhance flexibility. And occupational therapy can help you adapt daily activities to minimize discomfort. If you find yourself reaching for an anti-inflammatory medication almost daily to manage some form of pain, consider this a clear signal that a comprehensive medical reevaluation is warranted. This isn't a long-term solution. It's an indicator that the underlying cause of your pain needs to be thoroughly investigated and addressed. Medication number 4. Decongestants. Found in cold and flu medications, these are the colorful capsules and tablets, often marketed as multi-symptom relievers, that countless individuals, especially in Brazil, turn to when they're feeling congested during the colder months. These common, often over-the-counter cold and flu remedies contain ingredients designed to relieve stuffy noses. The decongestant ingredients, typically pseudoephedrine or phenylephrine, have a direct and powerful action on the blood vessels. They work by causing these vessels to constrict or narrow, which helps to reduce swelling in the nasal passages, thereby unclogging your nose and making breathing easier. The crucial problem, however, is that this vasoconstriction effect is not confined solely to the blood vessels in your nose. These ingredients are absorbed into your bloodstream and circulate throughout your entire body, causing blood vessels in other areas to constrict as well. This widespread narrowing of blood vessels can lead to sudden and significant spikes in blood pressure. In some susceptible individuals, It can also trigger cardiac arrhythmias, which are irregular heartbeats that can range from benign to life-threatening. For a young, otherwise healthy person, this systemic effect might pass almost unnoticed or only result in a mild, transient increase in heart rate or blood pressure. However, for someone over the age of 60, especially an individual who already has pre-existing conditions, such as high blood pressure, hypertension, or other underlying heart problems, this sudden and often substantial increase in blood pressure can be extremely dangerous. I have personally witnessed patients arrive in the emergency room with dangerously high blood pressure readings, sometimes at crisis levels, after simply taking an ordinary over-the-counter cold medicine for a common flu. This scenario is, unfortunately, less rare than many people might assume, and highlights the hidden risks of seemingly innocuous medications when taken by an aging population. What to discuss with your doctor. If you are seeking relief from a stuffy nose, it is wise to consult your doctor about safer alternatives. Saline nasal rinses, using a neti pot or a saline spray, are remarkably effective at clearing nasal passages and are completely safe, as they work locally without systemic absorption. Non-decongestant antihistamines might also be an option if your congestion is due to allergies. Most importantly, always make it a habit to meticulously read the label of any cold or flu medication before you take it. Be especially vigilant if you see a D appended to the name of the product, for example, Dayquil D, Allegra D, as this letter very often indicates the presence of a decongestant ingredient. Your pharmacist can also be an invaluable resource in identifying medications that are safe for your specific health profile. Medication number 3. Corticosteroids in prolonged use. Here, we are referring to powerful medications such as prednisone, prednisolone, and dexamethasone, among others in this class. These drugs are incredibly potent and immensely valuable in a multitude of medical situations. They are frequently prescribed for acute flare-ups of conditions like arthritis, severe asthma attacks, various autoimmune disorders, and serious allergic reactions. In moments of emergency, corticosteroids can quite literally be life-saving. The concern with these medications does not lie in their short-term, judiciously indicated use, where their benefits far outweigh potential risks. The critical problem emerges when these powerful drugs transition from being short-term interventions to becoming an integral part of a daily routine, week after week, month after month, often without rigorous and ongoing medical supervision. With prolonged use, corticosteroids can unleash a cascade of adverse effects on the body, particularly detrimental to individuals over 60. They are known to significantly elevate blood pressure, contributing to or worsening hypertension. They can increase blood sugar levels, potentially leading to the development of type 2 diabetes or making existing diabetes more difficult to control. Corticosteroids frequently cause fluid retention, which can further strain the heart and kidneys and contribute to elevated blood pressure. Furthermore, they can accelerate the formation of atherosclerotic plaques in the blood vessels, a process known as atherosclerosis, which is the underlying cause of most heart attacks and strokes. This means they actively contribute to the hardening and narrowing of arteries. Beyond cardiovascular effects, prolonged corticosteroid use also weakens bones, making them more brittle and substantially increasing the risk of fractures, especially in older adults who are already prone to osteoporosis. All these effects combined in individuals over 60 constitute a powerful set of factors that significantly heighten overall cardiovascular risk, not to mention other systemic problems. And now for the most absolutely critical warning within this entire discussion. Under no circumstances should you ever abruptly stop taking a corticosteroid, especially if you have been using it for an extended period. Your body, specifically your adrenal glands, which naturally produce a similar hormone called cortisol, becomes accustomed to the presence of the external corticosteroid. When you take these medications for a long time, your adrenal glands become suppressed and weakened, reducing their own cortisol production. Suddenly stopping the medication can precipitate a severe and potentially life-threatening condition called acute adrenal insufficiency, which is a medical emergency requiring immediate hospitalization. Therefore, any decision regarding a change in corticosteroid use, particularly its reduction or discontinuation, must be made solely by your doctor. This process invariably involves a carefully structured, gradual weaning schedule, meticulously supervised to ensure your safety and allow your adrenal glands to slowly resume their natural function. What to discuss with your doctor. If you are currently taking oral corticosteroids for an extended duration, it is absolutely essential to schedule a consultation specifically to reevaluate the ongoing indication for this medication. Engage your doctor in a discussion about potential alternative and safer treatments for your specific condition. For example, for arthritis, there may be disease-modifying anti-rheumatic drugs, DMARDs, that offer long-term control with fewer systemic side effects. For asthma, inhaled corticosteroids delivered directly to the lungs can be very effective with minimal systemic absorption. For autoimmune conditions, newer biologic therapies might offer targeted relief. Inquire about the feasibility of a gradual reduction in your corticosteroid dose, always under strict medical guidance. This crucial conversation has the potential to profoundly alter your long-term health prognosis and reduce your risk profile. Medication number 2. Sleeping pills, especially benzodiazepines and similar medications. This category encompasses widely prescribed medications such as clonazepam, diazepam, alprazolam, lorazepam, and zolpidem, often referred to as Z-drugs. In Brazil, and indeed globally, these drugs are consumed by millions of people, particularly individuals over the age of 60, many of whom have been taking them for years, sometimes even decades, without interruption. While they are undoubtedly effective in aiding sleep and helping to manage anxiety, their efficacy can inadvertently lead to them becoming an almost ingrained habit, obscuring the serious risks associated with their prolonged use, particularly in older adults. The first and most immediate risk, one that has a profound impact on the quality and longevity of life for older individuals, is a significantly increased risk of falls. These medications can cause drowsiness, dizziness, impaired coordination, and slowed reaction times, all of which substantially elevate the likelihood of an elderly person falling during the night, perhaps when waking to use the restroom, or even shortly after waking in the morning. A fall in an elderly person is not a minor incident. It frequently results in severe injuries, such as hip fractures, which can drastically alter the course of their life, often leading to prolonged hospitalization, loss of independence, and a diminished quality of life. Second critical risk is cardiovascular. Extensive observational studies involving older adults have consistently demonstrated a concerning association between the prolonged use of benzodiazepines and a heightened risk of adverse cardiovascular events. These events can include heart attacks, strokes, and irregular heart rhythms. Furthermore, long-term use has been linked to an increased overall mortality rate, especially when these pills are combined with alcohol or other medications that also depress the central nervous system. Beyond physical risks, these medications can also contribute to cognitive impairment, affecting memory and overall brain function over time. However, and please listen with the utmost attention to this, you absolutely cannot, under any circumstances, stop taking these sleeping pills abruptly. A sudden withdrawal from these medications can trigger a very severe and dangerous withdrawal syndrome. This syndrome can manifest with extreme anxiety, a rebound insomnia that is often worse than the original problem, uncontrollable tremors, and in the most severe cases, even seizures, which can be life-threatening. Any reduction in the dosage of these medications must be executed with extreme caution, following a very gradual, tapering schedule that typically extends over several weeks or even many months, and always, without exception, under the direct and meticulous supervision of your medical doctor. What to discuss with your doctor. Schedule a dedicated, unhurried consultation with your physician specifically to discuss your current use of these medications. Be completely transparent about how long you have been taking them and at what dosage. Inquire about the possibility of developing a structured, gradual reduction plan, should that be deemed appropriate for your situation. Beyond medication, explore alternative strategies for managing insomnia. Melatonin, under medical guidance, can be a safer option for some. Crucially, focus on improving sleep hygiene, consistent sleep schedule, creating a dark and quiet sleep environment, avoiding caffeine and heavy meals before bed. Cognitive behavioral therapy for insomnia, CBTI, is a highly effective, evidence-based, non-pharmacological treatment for chronic insomnia and should be seriously considered. For anxiety, there are often safer long-term medication options or therapeutic approaches available. All these decisions and plans, however, must be made collaboratively with your doctor, who can guide you through the process safely and effectively. Medication number 1. Proton pump inhibitors, PPIs, in chronic use. Finally, we arrive at medication number 1, the one I alluded to at the beginning, the most common, the most underestimated, and quite possibly present in your home right now, taken for years without question. This category includes proton pump inhibitors, drugs such as omeprazole, pantoprazole, esomeprazole, lansoprazole, and others belonging to the same pharmaceutical family. These medications are incredibly effective at significantly reducing the production of acid in the stomach. They are therefore invaluable for treating conditions like gastroesophageal reflux disease, GERD, stomach ulcers, and gastritis. The critical issue, however, lies not in their efficacy, but in their intended duration of use versus their actual real-world application. PPIs were initially developed and approved for short-term treatments, typically lasting only a few weeks, or for very specific medical conditions that genuinely require prolonged use under close medical supervision, for example, severe erosive esophagitis, Barrett's esophagus. Yet, the reality in Brazil and many other countries is that millions of people, particularly older adults, take these medications every single day for extended periods, 5, 10, even 15 years, without ever undergoing a periodic reevaluation to determine if they still genuinely need them. The medication simply becomes a part of their daily routine, a habit born of an initial prescription, often long forgotten why it was started. This very prolonged and often unreviewed use of PPIs carries several significant yet widely unrecognized health implications. Firstly, it can interfere with the absorption of vital nutrients from your diet, including vitamin B12, magnesium, and calcium. Deficiencies in these nutrients can lead to various health problems, such as nerve damage from B12 deficiency, muscle weakness and irregular heartbeats from magnesium deficiency, and increased risk of osteoporosis and fractures from calcium malabsorption. Secondly, chronic PPI use has been linked to a potential impairment of kidney function over many years, contributing to or worsening chronic kidney disease. Thirdly, by significantly reducing stomach acid, a natural barrier against pathogens, PPIs can increase the risk of certain intestinal infections, including Clostridium difficile, which can cause severe diarrhea. Finally, large observational studies have suggested a signal of increased cardiovascular risk associated with chronic PPI use, especially when these medications are combined with other existing cardiovascular risk factors. While this particular signal is still a subject of ongoing debate within the medical community and requires further definitive research, the evidence is sufficiently considerable to warrant a periodic reevaluation of chronic PPI use. Many people who have been taking omeprazole or similar drugs for years may no longer need them, or perhaps never truly needed them on a continuous basis after the initial acute phase of their condition passed. They were prescribed during a reflux crisis, continued taking them out of habit, and no one subsequently reevaluated the necessity of their ongoing use, allowing the medication to become an unquestioned part of their daily routine. What to discuss with your doctor. It is absolutely imperative to schedule a dedicated consultation with your doctor specifically to reevaluate your long-term use of this medication. Engage your physician in a frank discussion about whether you truly still require continuous use of a PPI. Explore various strategies for reducing or discontinuing the medication if deemed appropriate. This might involve a gradual tapering of the dose, using the medication only as needed for symptoms rather than daily, or transitioning to milder antacids for occasional relief. Moreover, improving your lifestyle and dietary habits can make an enormous difference in managing reflux and other gastric issues, often reducing or eliminating the need for medication. Consider these essential measures. Eating smaller, more frequent meals instead of large ones. Avoiding eating for at least 2 to 3 hours before lying down or going to bed. Elevating the head of your bed, using blocks under the bedposts or a wedge pillow to prevent acid reflux during sleep. And significantly reducing your intake of common triggers such as coffee, alcohol, fried foods, and other fatty foods. In many cases, these simple yet effective lifestyle modifications can bring reflux under control without the need for PPI. Pharmacological intervention. To summarize these 5 crucial categories: frequently used anti-inflammatory drugs, decongestants found in common cold and flu medications, corticosteroids when used for prolonged periods, sleeping pills, particularly benzodiazepines and Z drugs, and proton pump inhibitors used chronically. I want to pause for a moment and speak to you from the heart. I understand that this video has presented a significant amount of information, and it's quite possible you have recognized several of these medications as part of your own daily routine, or that of someone you care deeply about. I urge you to take 3 specific actions right now in the order I present them. Firstly, meticulously write down the name of every single medication you take. This comprehensive list should include everything, not just prescriptions, but also any over-the-counter drugs, supplements, and herbal remedies you purchase from the pharmacy without a doctor's order. Secondly, schedule an appointment with your primary care physician, your family doctor, or the clinician who oversees your general health. Bring your complete list of medications with you to this appointment. Be open and direct with your doctor. Explain, "Doctor, I watched a video and I want to have a thorough conversation about the real necessity of each of these medications in my current daily routine." Thirdly, and this point is absolutely fundamental, under no circumstances should you alter or discontinue any medication on your own initiative. Your goal for this consultation is to leave with a comprehensive plan developed collaboratively with your doctor, not with a unilateral decision you made by yourself. The process of reevaluating medications in older individuals, a practice that medical clinic professionals often refer to as deprescribing, is one of the single most important and impactful things you can do for your health after the age of 60. However, it is a process that absolutely must be undertaken with extreme care, following a structured methodology and under continuous medical supervision. And there's one more crucial point I need to reinforce with complete honesty. Many of these medications are, without a doubt, absolutely necessary and life-sustaining for countless individuals. Someone using corticosteroids to manage a severe autoimmune disease or a critical inflammatory condition will likely need to continue their use. An individual who has been taking sleeping pills for years may require many months of carefully supervised tapering to reduce their dosage safely, avoiding dangerous withdrawal symptoms. Someone using omeprazole for a serious condition like Barrett's esophagus will likely need to maintain that therapy to prevent progression to cancer. Each individual case is unique and requires personalized consideration. What truly matters is that these decisions are made in close partnership with your doctor, based on your specific medical history, current health status, and are reviewed periodically to ensure ongoing appropriateness and safety. It is genuinely never too late to take proactive steps to safeguard and improve your health. Preventive medicine stands as the most effective remedy, and today, you have added an intelligent, vigilant perspective to your personal healthcare regimen. An informed awareness of what substances enter your body every single day. This critical, discerning eye has the power to protect you from potential problems that many people don't even suspect exist. If this discussion has resonated with you, if it has provided valuable insight or sparked an important realization, please take a moment to share it now. Share it especially with those who care for elderly parents, with anyone living with an older family member, or with friends and loved ones who you know take multiple medications regularly. This type of empowering information needs to circulate widely within our communities, because it serves to protect and empower individuals to become active participants in their own health journey. The more people who are aware of these risks and the importance of informed dialogue, the more intelligent and life-saving conversations will take place in doctors' offices around the world. And finally, I invite you to share your thoughts in the comments section below. Which of these 5 categories of medications do you or someone in your family currently take? For how long have you been taking it? Were you previously aware of the potential risks associated with its prolonged use? I personally read every single comment. This community we are building here is filled with individuals who have made the conscious decision to be active partners in their own medical treatment, rather than passive recipients of care. I am Dr. Sofia Ferreira, and I look forward to seeing you in our next video. Take good care of yourself, and extend that care to those you love. And always remember, the best use of any medication is conscious use, discussed thoroughly with your doctor, and reviewed periodically as your health and circumstances evolve.